We will be discussing perceptions of community pharmacists to deliver asthma self-management and education. The University at Buffalo School of Pharmacy and Pharmaceutical Sciences worked in collaboration with the New York State Department of Health and pharmacy as part of the Community Pharmacy Enhanced Services Network of New York to complete this project. Asthma is a chronic respiratory disease that affects 26.5 million Americans. Inappropriate asthma management has led to excessive healthcare utilization and preventable mortality. Nowadays, community pharmacies have shown they are capable of executing clinical services around asthma. Asthma Self-Management and Education Service is a disease management program provided by pharmacies participating in CPESN, which help improve patient care in those with asthma through effective interventions including clinical monitoring. The primary purpose of the study is to evaluate the level of clinical services community pharmacies deliver to an asthma population. Secondary objectives are to determine community pharmacy network level of access to clinical information in an asthma population, assess the perception of community pharmacists in provision of asthma management and education program, and identify the barriers for community pharmacists to implement minimum clinical enhanced services in patients with asthma. This was a cross-sectional electronic needs assessment survey that was instituted in coordination with the University at Buffalo School of Pharmacy and Pharmaceutical Sciences and Community Pharmacy Enhanced Service Network. The CPESN is a clinically integrated network of pharmacies who deliver enhanced services that focus on improving clinical and global patient outcomes. The needs assessment was distributed via email to 125 CPESN pharmacies in New York, and the responses were collected from August to September 2020. The respondent sample included community pharmacists who are involved in the delivery of patient care services and are knowledgeable about ASME services. Aggregate data was analyzed using descriptive statistics. A total of 80 responses were collected. The majority of the respondents were pharmacy owners. The majority had over 21 years of experience, and the majority were from pharmacies in suburban and urban settings. 76% of respondents strongly agree that pharmacists play an important role in an asthma patient's healthcare team. The most common adult ASME services include education on spacer usage, education on proper administration methods, and counseling on differences between asthma-related medications. Respondents also stated they help patients overcome financial barriers by recommending cheaper alternatives, contacting prescribers to provide cheaper insurance-preferred alternatives, and providing a prescription savings program. Community pharmacies are prepared to enter into a more collaborative action in management of patients with asthma. Community pharmacists currently offer a wide range of ASME services. Pharmacists are ready and willing to provide services but face financial barriers to sustainability. Additional training in asthma management procedures and advanced relationship with other asthma professionals will be needed in the next steps. Additional research is required to overcome barriers necessary for the expansion of ASME services in the community pharmacy setting. This survey was completed by pharmacy student researchers Shin Pan and Anand Shah working with clinical pharmacist and professor Dr. Christopher Daly. Feel free to contact us with any questions or comments you may have, and thank you for your time and attention.